Hi, child development students. Today we're going to be covering Chapter 4 of the textbook, which is Normal and Exceptional Development. So this picture here on the left, I'm very proud. This actually was my son today, which is probably not today from the day that you're watching this. It was his first day of his new school at the Blind Children's Center. So I just wanted to share. We're very excited. It was a long, hard fight with the school district to get him into the school, but we're really proud that he started today. So we're very excited. So the objectives for this particular chapter is here, the following. What I'd like you to do, I want to give you a strategy that I think is really helpful for information processing. At the beginning of each chapter, not just for this class, but I would recommend for any of your classes, is to look at whatever the learning objectives or goals are at the beginning of the chapter. Take a look at each one and think about what is it that I already know about this topic. So you already bring a lot of prior knowledge to this course, being that you're students, being that you've been educated for several years. So you already bring a lot of knowledge to these topics. So I want you to think about how you would respond to these particular objectives first. So you're kind of tapping into prior knowledge. And I like to use the metaphor of, if you think of a coat closet and you have different hooks. So every time you are thinking about these objectives and what you already know, you're activating these hooks in your brain, just like in a coat closet. And then as you go through the chapter, you are going to be adding to your knowledge. You're going to be expanding with the examples, perhaps adding new information that you didn't know before. And then you're hanging information on these hooks of prior knowledge. So you're hanging a hat, or you're hanging a coat, or you're hanging a belt. So by the time you're done with the chapter, you've established these kind of schemas of knowledge, and then you're adding to them, and that helps with information processing. It helps the information go from your short-term memory to your working memory. So just a tip. And then at the end, of course, I would recommend going back to those same objectives and seeing how much you've expanded your knowledge and if you would be able to elaborate on those. So the first one is describe typical development and distinguish between developmental sequences and developmental milestones. Give examples of each in motor, social, cognitive, and language development. The second one is to explain the terms atypical and exceptional development and relate those terms to the development of young children. Finally, we have outline biological and environmental factors that can put infants and young children at developmental risk. So take a moment, look at each one of those individually, and think about, what are some things that I think would be able to respond to those objectives? What are some concepts, some things that I already know? Even if it's your best guess, I want you to just take a moment to think about, what do you already know about those individual objectives? What is normal or typical development? So I included a picture. This was my son Coco. This was when he was about 4 months old. Love the little rolls. This implies an ongoing process of growing, changing, and acquiring a range of complex skills. Beginning in earliest infancy, the process moves along a developmental continuum according to a predictable pattern common to most children of the same age. So the textbook talks about how there can be lots of variations, so we have to kind of proceed with caution in a way when we talk about normal, I'm going to use air quotes, normal or typical development. And that's because there's obviously going to be some individual differences. So you might have children who are in the same family who develop differently. So you might have one child walk at 8 months and then their sibling walks at 18 months. So individual development can differ, and then there can also be cultural differences with development. So the idea here is that for parents and educators and developmentalists, is we have to establish some sort of a benchmark to understand when children have deficits or when children are excelling beyond what the typical milestones are. So it's really a benchmark, but just to kind of consider that there are going to be some variations that are normal. Also, with the developmental sequences, we understand that children do learn in a sequence. Based on their age, we know what skills the children should learn next. So, for example, we understand that a child typically is going to babble and have cooing before they develop comprehensible language. Now, again, there's obviously exceptions to the rule, but typically a child develops proximal distally, so they have the trunk, head control first, and then the development goes outward to fine motor pinch or grasp. So we have ideas of how children develop normally so that we can understand those milestones, and we know that it happens sequentially. Also, we have developmental milestones. This is the order in which the child will learn the skills from the developmental sequence. And so in my son's case, I knew from a developmental standpoint that Colson was not meeting his developmental milestones, because by the time he was 6 months old, he had very limited head control. It still resembled that of a newborn. And so developmentally, we know that by 6 months of age, a child typically has more steady head control. They're possibly able to sit up, maybe even showing the beginning signs of crawling. And so those developmental milestones help to alert us whether or not a child is developing along the appropriate continuum, or if we need to intervene with early intervention or some other sort of interventions, or if it's just a matter of an individual difference and we just have to wait and give that child a little bit more time to develop. Infancy. So thinking about infancy, brain research has greatly improved. Many studies have been done on early brain stimulation and the lasting effects. Infants need caregivers and parents to offer activities, materials, and communication to enhance brain development. So right here on your left, you'll see I gave you a snip of an article. This is called You Can Grow Your Intelligence, which was written in part by Carol Dweck, who was kind of the pioneer of growth mindset. She's a psychologist out of Stanford University. I really value and respect her, and my dissertation was based on this information. So this is an article that I think is really, really great. I recommend that you take a look at it if you haven't already. It's written in a very student-friendly level. I've used it with 8th graders. So what this article reveals is that this brain research is relatively recent. So even though some of what we've discovered about the brain, neuroscience, neuroplasticity, etc., it sounds kind of common sense, but the reality is that it's only been since recently, I would say the past 15 to 20 years, that scientists have discovered that the brain is like a muscle and that you can develop and grow your brain. And so I think that's really important for us to keep in mind with development and using interventions and understanding that the brain is in fact malleable and that there are certain things that we can do that can help develop the brain. The last bullet here talks about how infants need caregivers and parents to give them stimulation to enhance brain development. So this article, it talks about a study that was done with animals in cages. I know, science for you. But in this particular experiment, there were animals, and it doesn't specify what type of animal, but they were animals that the control group had no stimulation, so they were in completely empty cages. And then the other animals, they were in cages with other animals, with toys, etc. So they looked at the brain density and noticed, as you would expect, that the animals that had the stimulation, they had the interaction with other animals and toys, that their brain density, their mass of their brain and the connections that were being made were much greater than those that did not have any stimulation. Similarly, an experiment discussed how older animals, when given more engagement and given objects and different things that were going to stimulate them and facilitate problem solving, that their brains actually grew as well. So that's saying you can't teach an old dog new tricks. Their finding is not necessarily true. You can, in fact. It may take a little bit longer and maybe with different strategies, but it is possible. Also with infancy, attachment is a big part of that. Attachment has begun through the give and take between the caregiver and the child. And this is really important for any of you who've ever been around infants. You notice that the social smile usually happens after a few weeks, up to about 2 months. And I remember with my first son, when we went to the 2-month checkup and she was making sure that this was a milestone that he was meeting, she would imitate, or she would make a face, a silly face, and hopefully elicit a smile. And my son did, in fact, smile, And what she said made a lot of sense. She said, see, this is when they give something back. So when you have an infant, newborn, you feel like, you're sleep deprived, your life is turned upside down. It's pretty much a one-sided deal. You're giving. You're feeding, changing diapers, bathing, etc., burping, all of that. And then when they give you that smile, that amazing smile, it's like, oh, your heart melts, and you're kind of reinvigorated to continue providing that care. So I think, that there's some evolution involved in that, where for parents, or caregivers, you're getting that feedback, you're getting that smile. And what do we usually do when a child smiles? Gaga goo. We start with the motherese, and we start with, making the silly faces, and it helps to facilitate that bonding relationship. Imagine if you had a child, and some children with developmental delays, this is the case. Imagine if you had a child that months and months after they're born, there's no emotion. They're not smiling, they're not cooing, they're not making eye contact, they're not babbling, and thinking about how difficult that is for the caregiver to not get that feedback. And it also can be an indication of a developmental issue. The infant is in the sensory motor stage of development, which is one of the first stage of Piaget's cognitive levels of development, where everything is being learned through the senses. So a lot of things going into the mouth, and grabbing things when they're able to, because that's how they're learning about their environment. They learn through movement and their senses. So normal or typical development in toddlerhood. So we're looking at from about 18 to 30 months of age. Walking is well established by this time. And if it's not established at this time, then you might want to look into possible adaptive PE or assessments just to determine what's going on, some sort of physical therapy if possible. Toilet training may begin. Independence is sought. So this is when, it's the safe haven and secure base. The word mine enters the vocabulary. No, it's mine, right? So this is what we call the terrible twos. So the safe haven and secure base is a cool concept that is related to attachment. So when you have a child who has a healthy attachment with their caregiver, and they're physically with their caregiver, that caregiver is considered a secure base. And so when that secure base is established, the child feels confident and comfortable to be able to go out and explore in their environment. So if you imagine a child and a caregiver at a playground, the child feels that secure base, and then they're able to go and explore, the slide and the sandbox, etc. Now, when the child is away from the caregiver, that caregiver's role switches from a secure base to a safe haven. So when that child needs reassurance, they fall down or they get scared, that parent is the safe haven, and so they can go back to that parent who was their safe haven, and then that parent's relationship returns back to the secure base. And that's all part of kind of the healthy attachment cycle. In the preschool years, we're looking at ages 3 to 6. Children are developing creativity, language is used correctly and understood by most older people, physical skills are greatly improved, and empathy towards others and sharing are apparent. So you see a huge jump of development from toddlerhood to the preschool ages. And then we have the primary years. Learning to read is the major milestone for this group. So we're looking at first, second, third grade. Best friends and friendships are important. Self-care skills are done independently. So toileting, washing hands, possibly the beginning of brushing teeth, although my son's dentist said we shouldn't allow that until they're 7 to do it appropriately. And then growth is slowed, but still continues. So they're not growing at the same rate as they were in infancy and toddlerhood, but it's still in an upward trajectory. So what is atypical development? Developmental disabilities and delays. That's one example. A child is unable to perform like typically developing peers, but the potential for growth is still present. And these delays and disabilities exist when a child is performing like a child who is typically developing at a much younger age. So here you see, this is my son Colson, and this is at the amazing Napa Therapy Center where some of you may be going to do your observations. So even though Colson will be 5, he is developmentally probably around a 3 to 5 month old. So we're still working on head control. We're still working on sitting up. But as you can see, they're working on having Colson in the prone position. So it looks like, setting him up to crawl just to practice bearing weight, because that's not something that he's typically able to do. So that would be an example of a developmental delay, because even though he's 5, you would expect a 5-year-old to be running around. We are still working on very basic movements. So children are at developmental risk. There can be biological risks as well as environmental risks. So biological risks can include birth defects, chromosomal abnormalities, and heart defects. And environmental risks can include poverty and child abuse and neglect. So these are all of the different factors that can put children at risk for their development. So you notice some of these things can happen before, during, and after birth, and then environmental typically happens after birth, but there can be environmental factors that affect the parent, the mother, while she's carrying the child, that can then affect the child after birth. Then the textbook also talks about resilience and vulnerability. Resilient children take the worst and make the best out of it. And vulnerable children do not recover from the worst and continue a downward spiral. So the textbook talks about the fact that you can have a vulnerable child in a facilitative environment. So if there are resources available, if the environment is conducive to that child getting assistance or improving whatever their deficits are, then that child can be successful. You can also have resilient children in a very negative environment, and that child probably will do well. But the double whammy is when you have a vulnerable child who's in a very poor environment, and it's very hard for them to recover from that. On the other side of the continuum that we talked about, so one side of the continuum we talk about children who are delayed, and then on the other side we have children who excel, who are ahead of their typically developing peers, and this would include children with special gifts and talents. I like to consider all of this under the umbrella of exceptional children. So there's a theory of multiple intelligences. Gardner says that there are 8. Do you know what those 8 are? You might want to check and Google that. And everyone has one intelligence that is stronger than the others. There are also characteristics of young and gifted children. They typically have advanced vocabulary. They learn quickly. They're curious. They ask a lot of questions. They like to challenge what information is presented to them, which can be challenging, but it's also a sign of their thought process and their critical thinking. They can find and solve difficult and unusual problems. So those are some characteristics of gifted and talented children. So there's also the possibility that children with developmental disabilities are gifted, and I think this goes against common assumption sometimes. Yes, you can have a disability and be gifted at the same time, sometimes even in the same developmental domain. Children with disabilities still need to be considered for gifted programs. So even if you have a child who has Down syndrome or has been diagnosed with attention deficit hyperactivity disorder or autism, it doesn't rule out the fact that they can also display the characteristics of a gifted child, and they should be able to get those resources as well. Identification needs to come from classroom observations, not purely test scores. Thank you. Yes, I think that's huge to acknowledge that tests alone do not determine a child's, or anyone's for that matter, their potential and their capacity to learn. So now that we've covered the main points of this chapter, I just want you to take a moment to go back to the objectives from the beginning and see if you can elaborate more. This is a good way to check your understanding and test your comprehension for the learning celebrations, to just see if you're on track, if the information and concepts are sticking. So just go back to the objectives, revisit them, think about how you would elaborate. Maybe you can clarify any misconceptions or misunderstandings that you have. You can add more information to your notes based on the information from the textbook, from this PowerPoint, from your notes, and use these objectives as kind of your guide. So thank you for listening. See you next time.